Beyond the Pelvis is hosted by Dr. Keneal Siegel, a pelvic floor PT and intuitive healer, and Laura Haraka, a somatic practitioner and breathwork facilitator. Each week, we explore alternative and holistic approaches to healing chronic pelvic pain and other painful or chronic conditions. Join us and other experts in mind, body, and spiritual healing as we discuss a wealth of modalities ranging from ancient practices to modern therapies that challenge the conventional Western model of treatment. Let's get right to it.
So welcome back to another episode of Beyond the Pelvis. Today we have Tara King here with us today. Tara is a doctor of physical therapy specializing in pelvic health and chronic pain. After recovering from decades of chronic pelvic pain, back pain, neck pain, and headaches, Tara turned her clinical practice toward empowering others to do the same. She now heads up operations at Lin Health, a digital health clinic that uses behavioral health and cognitive pain reprogramming to help people recover from chronic pain. Welcome, Tara. Thank you so much for being here with us today.
I am so grateful to you for bringing me on the podcast. All of these topics are my favorite things to talk about.
Well, we're happy to have you. And why don't you go ahead and share, because I think it will be really useful for people to hear, but tell us a little bit more about your experience with chronic pelvic pain, all the above.
Yeah. So all you just heard, all the work I do is because my personal pain story led me to these professions. So I had low back pain starting at age 16 as a dancer. I was in a physical therapist's office literally 3 nights a week at like 9 p.m. trying to put me back together, so to say. This turned into chronic SI joint pain that I carried through university. And then come my senior year of university, I got diagnosed with a disease called Mollaret's meningitis. It is caused by HSV2. So pelvic PTs in the room, it is caused by a herpes virus. So I'd already had some chronic pelvic pain from actually some poor advice from a physical therapist to hold a permanent Kegel. And then I would say after that point, I kind of layered on some new layers of chronic pain as well. So along with that, recurrent meningitis. So Mollaret's meningitis is a form of aseptic, recurrent, benign meningitis, meaning that it wasn't bacterial, so my life wasn't at risk, but it was just kind of this vague, unknown disease that apparently lived at the base of my spinal cord and could attack me at any time. So from that point on, I had neck aches and headaches pretty much every day, starting at around 3 p.m. That sometimes left me bedridden by dinner time. So that was my 20s. And I did everything I could to try to heal. I went to probably every type of practitioner, from intuitive energy healer to acupuncturist to every type of physical therapist to infectious disease doctors. And nobody could really move the needle. And that brought me to physical therapy school myself. I thought, maybe I just need to know what they know, and then I could heal myself. So tens of thousands of dollars, not including physical therapy school later, I am in the classroom, and bless Regis University's heart, I was exposed to pain neuroscience, and the book Explain Pain was part of our curriculum. And I heard studies about how imaging findings in the low back, the hip labrum, the rotator cuff did not match patients' pain experience. And I started to think, this is amazing. This feels kind of like my case, since nobody can ever find anything wrong, majorly wrong, with my back or my SI joint. And that kind of helped me heal my back, but my neck and my head kind of felt like a different thing. So my favorite thing about my healing journey is that I spent so much money trying to heal and didn't heal. And I ultimately feel like I healed for free. So during COVID, an announcement was put out needing course liaisons for Charlie Merrill, who you've had on this podcast, and Dr. Howard Schubiner's course Beyond Pain Education. And I was like, sure, I would love to take this course for free and run your Zoom chat. I can do that. I need to know everything about pain. So I joined this course and immediately everything lands with me. It makes complete sense that there's something going on besides structural damage in my body for my low back, for my pelvis, for my hip, for my SI joint, kind of everything below the waist. I was like, this makes sense. But my neck aches and headaches were a different thing. So I'm introducing myself in the course, and I kind of say what I said to you. I've had this type of chronic pain, and then my neck aches and headaches are from this disease, and there's nothing I could do about it. Doctors have told me there's no cure. This is something I live with. And bless Dr. Howard Schubiner's heart, he private messages me in Zoom and is like, well, I've never heard of Mollaret's meningitis, but I do treat many people with post-herpetic neuralgia, and it ends up being what he coined mind-body syndrome, what I more call a neural circuit disorder or neuroplastic pain. Would you be open to talking to me? And then I email stalked him for like 2 months until he finally got on the phone with me. And within 30 minutes, my life was completely changed. He listened to my symptom presentation and was like, that doesn't really match up with viral physiology. That's not how viruses work. A virus cannot replicate itself in your body each day by 3 p.m. to cause a neck ache and headache that is what you coined the start of meningitis feelings, and then be gone by the morning and then start again the next day. And once he said it like that, it did feel so ridiculous because we've had other viruses in our life and that's not how they operate. But I think that in trying to understand our pain, and when we see doctor after doctor, we get given these physiological explanations, biomechanical explanations, which are actually kind of ludicrous. But when we piece them together, we're like, okay, this is must be why I have pain. And we walk around with it. And it really, for me, it took a doctor looking me in the eye and saying, that's really just not how viruses work. And it took a few months of kind of rewiring my nervous system towards not freaking out when 3 p.m. came around that, oh my God, this headache was going to come on and I was going to end up in bed. And within a few months, I was out and on the other side. And here I am sharing it with the world. So
That is amazing. And for me, I had a similar story where I needed a doctor to tell me that this was mind body. I had other people in my life telling me that this was possibly mind body, but I went to see a doctor in Jersey, Dr. Paul Watts, and he diagnosed me. And from that moment, it was like a light bulb went off in my head, and I was able to apply the reprocessing and calming down my nervous system. So sometimes it does take a doctor to have that switch go off.
And I wish it didn't. I wish we could just be empowered to do it all on our own. And that's part of also why I became a physical therapist, is that sometimes people just need somebody with a license to practice in front of their name to show them a different way of what might be going on in their body.
It was interesting that you were a physical therapist at the time. So you were already a DPT. And you still like separated from the waist down. Okay, I managed that with Explain Pain, the book. And then from the waist up, you were like, oh, this is because of this disease. And you still needed someone with different credentials to tell you, no, honey, this is not that.
I know. Yeah. And I mean, having that drastic shift allowed me to then ask, well, what else could this apply to? And that eventually led me to just being interested in all chronic pain and symptoms, and leaving in-person clinical practice after I had my daughter and going straight to the digital health space with Lin Health, where this work is applied to people with various autoimmune disorders. Kind of any time that the nervous system gets a little bit out of whack. I would even say like dermatological conditions. I started being like, well, what's going on there? That doesn't quite make sense. Just like my virus didn't quite make sense. So it's been a really fun ride so far.
So just to go back, did you have experience as a physical therapist as a pelvic health PT, or were you doing orthopedic PT?
I did both.
You did both. Okay. So you did
I did both.
have experience as a pelvic floor PT as well. That's interesting.
Oh, yes.
Yeah,
Yes.
I
My absolute
stuck out
favorite.
for me was that permanent Kegel that
Oh,
one physical therapist. So can we talk about that?
we can absolutely talk about that. So, I was 18 quite some time ago, and pelvic PT was just, there wasn't really the internet to research it. There wasn't TikTok videos and Instagram of people really normalizing it. I got told it by a male PT when I was 18, and I consented to care. And then I was told to hold my abdominals and my pelvic floor in a permanent contraction whenever my low back hurt. And now we know within our fields as pelvic PTs that that is literally the opposite of what you want to do. And also, that type of constant contraction led to me peeing my pants often throughout my 20s, led to pain with intercourse, and led to me actually feeling way more broken than I did when I just had low back pain. So I went on my journey to become a physical therapist. I always knew I wanted to get into pelvic floor PT because I care that the practitioner delivering it is delivering what is the current best evidence, and also is listening to how a patient responds, right? If your patient is not getting better, or if you're somebody going to pelvic PT or any provider and you're not getting better, you all in the room need to be asking questions critically of why not, and not putting the blame on the patient, which so often happened to me.
Yeah, I feel like that directly goes back to like that individualized trauma sensitive care. Like you have to listen to the person and then evaluate, is this working? If not, why not? And then when it is working, why is it working? Like you need to evaluate everything, right? Because if it is working, okay, great, that works. Why? Let's do more of that. If it's not working, let's not do more of that. Like that's just it feels like common sense, but then again, not all of us practice common sense, unfortunately, hence why you experienced that kind of treatment by someone who should have known better. That also makes me think of those yoni eggs. Are you familiar with those?
Yes. I'm a
Yeah.
yoga teacher also, so I've heard of yoni eggs.
Right. I mean, yes, not to shame anyone using them, but it's the same idea. Put something in your body and then hold it constantly all day long. That never made sense to me. I just never understood it. Like, would you walk around with a bowling ball contracted in your biceps all day in order to be strong in your biceps? Why would you do that with your pelvic floor? So, where I went with
I will
that.
say I really like to honor the experience of the individual in front of me. And if a yoni egg serves them, that's amazing. Go for it. If it doesn't serve you, let you not feel shame or bad about it. There are reasons why it might not. And I truly feel that way about every treatment, even though I've kind of gone down the nervous system first approach of neural circuits and rewiring pain systems. If chiropractic works for you, go for it. Like, we all want relief from pain. Just if it stops working, let us not believe that you're more broken because it stopped working, but maybe we talk about why perhaps it was working in the first place so that you can be empowered to find something that works for you, maybe more often. That's more in your control.
So true. And I just want to say, I literally cringed when you said you had to hold that Kegel for that long, having been a pelvic pain patient myself. So, how did you learn from this point on how to guide patients in recovery?
I'll tell you what, when I learned this pain science stuff, which I'm saying it in that way because if people have listened to earlier episodes of your podcast, they do have a good idea about it. But just as a quick primer for anyone who hasn't, all pain is mediated by the central nervous system, whether it's structural or not. So I'm talking about all pain, really. And I messed up many times, even as a student trying to explain this stuff to patients. And I want to normalize to providers and to people who hear this information for the first time. It really depends how it's delivered, what thread really makes you think about your body and your symptoms in a different way. And there really is an art to it. So I learned this approach by messing up a lot and then finding the way that worked the most. So I will say with the pelvic floor, it was an easier explanation than it might be for the shoulder, that your nervous system is involved in your pain presentation because of our wonderful pudendal nerve. So pudendal nerve has autonomic nervous system inputs. Oh my goodness. That automatic part of your nervous system with sympathetic and parasympathetic goes right into your pelvic floor muscles. So if you're feeling fight or flighty, sympathetic, or chilled out, parasympathetic, your pelvic floor muscles hear it. So the idea that your nervous system might be impacting your pelvic floor, or your stress might be, is actually quite neurophysiologically conveniently acceptable to people, because that's just how it works. Versus the shoulder, it's a little bit more difficult for people to understand. So I was fearful at first to bring this to patients because I did not want to invalidate what they felt. But I think my own personal experience of recognizing, wow, okay, I'm not broken. I just was told these things about my pelvic floor and peed my pants and felt so much shame around my pelvic floor that of course it was trying to contract to protect me, and contraction was equivalent to reducing pain for me. Like there was such a mess going on down there that once I learned that if I just relaxed or just stopped trying to contract my pelvic floor muscles all the time and I felt peace, it made it easier to pass that on to patients and friends and everybody as well, honestly. So, and I actually found patients to be grateful for this information rather than invalidated. And that was the biggest surprise of my career so far, I would say.
Because it's so important to validate someone. And when I first had my pelvic pain, I had people try and explain to me that, oh, this could be part of the nervous system. And I felt, no way. This pain is so real. So it really takes a technique to explain to people why this is happening so they feel validated and they feel heard and they feel understood.
The biggest heartbreak of my life currently is when people learn the physiology, neurophysiology of pain, and they walk away saying, so my pain's all in my head. Because your brain is in your body. And if I cut off your brain from your body, you'd actually die, because your brain runs everything in your body along with nerve inputs from the periphery and descending pathways of nerves that come down from the brain. It's continuous, right? So it's just so interesting to me that it's not, the brain and the nervous system aren't just seen as another part of your body, but are seen as this woo-woo thought, psychological mind, just because there's part of the brain that we can control with thoughts. So that's my biggest heartbreak. And that's my biggest work right now, is really just trying to remind people that your brain is in your body and is actually part of your body. So of course it's involved.
I mean, when we look at the example from nature, like plants have a nervous system, but we don't think of them as having a brain in their heads like we do, but they have a nervous system and they have senses. They can sense color, they can sense smell, they can sense touch, they can sense all of these things despite not having a brain, but they have a nervous system. So it's just reframing the thought of, oh, it's our brain that controls everything. It's like, that's part of it. It's the nervous system. It's the whole body. It's really the nervous system, right? So I think that's where people get tripped up, is they think just the brain. Oh, it's only the brain, where it's no, that's just part of the nervous system. Like, to me, I've said it before, like the heart, the gut, and the brain are the three main brain, like nervous systems, the three main parts of the nervous system. For me, it's heart being number one, brain and gut can fight for two and three. But it's all part of the nervous system. And it's just understanding that, and just that mindset shift of, let's look at it as the nervous system versus just this brain, the thing in your head.
Yeah. And like, it's not just how your body works, it's how all bodies work. This is a fact of being human. So there's not really something to believe or not believe. This is how our nervous systems operate within our body, and this is how the perception of pain happens.
So I'm just curious, what are some of the techniques you do with your clients and patients to help them regulate their nervous system?
So, in the in person pelvic PT world, I feel like I kind of created my own practices that combined the pain recovery coaching that I do at Lin with the in person pelvic PT. So, I would take manual therapy practices, but instead of talking about tight muscles, we would talk about what response does this bring up in your body. I just noticed that your shoulders tensed when we went on your, ischiococcygeus on your left side. What's going on? Okay, if I go with lighter touch, how does that feel? It feels more firm. Isn't that interesting? Our sensation has changed even though I'm using less pressure. Let's work with that. So I'd use like graded exposure to touch in that kind of way. And graded exposure can truly start with visualization. Like if somebody has pain when we just start the exam and I'm, visualizing externally, you bet we are not doing any type of internal exam or external exam. That is where we're starting with our graded exposure hierarchy. So provocative testing, I guess I would say, is another tool that I will use. That's from Dr. Howard Schubiner. Thematic tracking, certainly. And I also just think it is, if pain is a danger signal trying to tell you about danger in an area, how can we bring a safety signal to an area? And an area like the pelvic floor, that can be harder than, again, like your shoulder or your nose or your ear, depending on what's happened to you in your life. So different things we'll do for safety is just bringing in another sense, like your visual cortex. So can you visualize with a mirror and see where you are touching? You can also do some sensory remapping with that, right? Like there's neural smudging that happens when people are in chronic pain. So how can we remap your pelvic floor region so that it's not so you touch one area and every region related to the pelvis lights up in your head with every pain pathway, but instead we're back to touch, area of the body, no pain. Touch, area of the body, no pain. I'll also have people do, depending on what their symptoms are, like a menstruation ritual or an intercourse ritual, where before these triggers in their life, we are setting up the nervous system with safety through breathing, stretching, mantras, or different thoughts that we'll send down to that body area. Also looking at the environment. Okay, you're going to engage in sexual intercourse. Have you read the book Come As You Are by Emily Nagoski? Oh, it's so wonderful. So she has this list of sexual activators and sexual inhibitors. So I will actually have patients fill this out. And before you are going to engage in intercourse, how high are your activators versus your inhibitors? I see this as like the danger in me and the safety in me concept from Lorimer and Mosley's Explain Pain. What is our danger to our safety level here? If you're walking into this situation and your dangers are 3 times as high as your safeties, are you giving your pelvic floor a chance to relax and to not sense danger? So those are a few of them. I could talk about it forever.
I love that you said when someone comes in your office and they're already in pain, you don't just go internally. So it means so much for me to hear someone say that because I was a pelvic pain patient. And I'm so happy that these modalities are there now for people moving forward because I wasn't lucky enough to have your expertise or Keneal's expertise at the time of doing these different types of healing.
Neither was I. The amount of times I cried on a physical therapist's table, be it for my low back, my SI joint, or my pelvic floor, and they just kind of looked at me like, I have so much pity and empathy for you, but I actually have nothing else to offer you, was so hard. And I think the best part about like Lin Health and the tools that I have learned in this pain reprocessing world is that there are infinite tools that we can use. and it's not hopeless for you. And I actually also understand why you're crying. And I could sit with you during this instead of feeling like I don't know what to do and it's my fault. So then I'll put it back on you. These tools break the cycle.
I don't consider myself like someone who's experienced chronic pelvic pain. I have had things here or there. I mean, I've had children, so I've had like tears and the stitching and that hurt. I've had back pain and pain from the epidural site that went on chronically. Like I had things that come up here or there, but I never really considered myself someone who did experience chronic pelvic pain, but I can still empathize having experienced pains, different kinds of pains in my life. And it does make me sad too. Like it breaks my heart to hear that people still to this day will experience, poor treatment or a traumatic care with a physical therapist, especially when it comes to pelvic health, physical therapy, because I feel like we hold ourselves, or maybe this is me, I hold us to a different standard because we are working with very sensitive areas and sensitive conditions. I feel like we just have to come in with already this like lens of how can we make someone feel safe and secure and heard because they are experiencing something so sensitive. And even though I have not experienced, per se, the same level of chronic pelvic pain as, you or Laura has experienced, I can still sort of empathize and hold space. And for me in that moment, I feel like the most important thing to do is to just see the person as a person, not you, this person experiencing chronic pelvic pain or the pain patient. I don't even use those terms. I say someone who is experiencing pelvic pain because language matters. I see you as the person and what is it do you need right now? And if that's take a moment to cry, then take a moment to cry. If that's I just want to sit here, then sit there. I just want to talk about my experience, talk about your experience. And I feel like that's why my sessions look and feel so differently than physical therapy because anyone that's ever worked with me knows that we're probably going to talk for a while. And because that's how I hold space. I hold space by giving them the opportunity to feel safe. And if that means sharing their story because they haven't had the opportunity to share their story with a medical provider, then I'm gonna sit and I'm gonna listen and I'm gonna grab a box of tissue and you can shed those tears and I'm gonna cry with you and then we get to it. We figure out ways of allowing them to feel safe in their bodies and go forward in that way.
1,000%. I want to come see you is how I feel right now after you talking. And also our words, I recognized this very early on because of how many words harmed me, but our words can also be our most powerful tool for helping people in their healing. And that is why I now only use words, actually. And in this digital health space, it's incredible that information and tools and practices that people can do on their own can heal better than all the modalities that I had in person as a physical therapist. And it certainly depends on the individual. But I'd always kind of thought when I went into full time pain recovery coaching and then managing all of the coaches, I'll go back to in person care. I'll go back to in person care after I had my daughter. And I still haven't gone back because I'm kind of addicted to watching these recovery stories that are happening in a virtual setting in people's living rooms, insurance backed a lot of the time, which is amazing. And I just feel like the power is, it's hard. It's hard to walk away from the impact.
And for those of us that are like manual therapy or manual heavy, like we can teach people how to do things on their own. And is that not our job at the end of the day is to teach the individual how to be in their bodies? So if you are constantly doing the things to them and not even teaching them how to do that, then what are you really teaching them? You have to, at the end of the day, teach that individual how to be in their body and how to manage their symptoms. And it's not, I'm teaching you how to do this manual therapy because it's tight or whatever the case is. I'm teaching you how to do this so that you can feel safe in your body using a manual technique.
I just got to tell one patient's story based off what you just said. Is that all right? I had somebody come to me, and before they came to me, I received 60 pages of their faxed medical record from a pain clinic somewhere in the country. And I felt out of my league, like, oh boy, what am I ever going to be able to do for this person? They had a vaginal pull down surgery, something I had never heard of, but was horrified to read the term for, vestibulectomy for their vulvodynia, their pain in the vulvar region. I met them. They're obviously wonderful. One of my favorite patients I've ever worked with. Within 2 weeks, her pain had shifted. Within a month, she was able to engage in intercourse again in a way that was not painful at all. Mind you, she was off limits, constant burning, constant pain for like 2 years before that. I tell this because I'm simultaneously amazed and happy for her, and also completely feel sick for the path that she took before she got to me. And sometimes people do need surgery in their healing journey to truly feel like they've addressed the structure and then, okay, fine. But it really just took a conversation about the pudendal nerve and about the autonomic nervous system and about how muscles are innervated by the nervous system. And when they go like this and they contract, they could be reasonable. Why might your muscles be doing that? Because you don't like your partner, because you had bad experience in the past with the partner, and because you had a vaginal pull down surgery. I say this to people postpartum too, like, yeah, of course your muscles decided to seize up and you have pain with intercourse. The last thing that came out of there was a baby. So your body's reasonable, even if it hurts. There's usually a reason, and finding compassion for that reason, I feel, is one of the best ways through. So that's what ended up happening with that patient, and eventually broke up with the partner and understood and felt in control of her body for the first time in a long time. I wished what happened before it didn't have to happen for her, but it goes to show, even when there's been really serious surgeries and you've been through all the pain clinic stuff, a little bit of information, validation, and getting curious about your symptoms with your triggers can be very healing.
Yeah, that's amazing. I actually have had multiple procedures, tests, and I even had a surgery to correct what they thought was wrong. So I wish I found mind body healing a little quicker, obviously, just like your patient. But one thing you said before was words. And as PTs, as doctors, your words are so important. I have had clients go to physical therapists and say, your condition is just going to get worse. We just need to manage it. That is devastating to a client because words can really affect how we heal, because our belief is so important in our healing, and that I don't have to just manage my pain. I don't have to have it at all. And I just need techniques if something happens, because everybody gets pain sometimes, everybody gets a flare up sometimes, techniques what to do. And finding that trigger, like you said, is so important. But I do want to say, having you told that story, sometimes I'm so happy for that client that it happened that quick, but sometimes it doesn't happen that quickly for a client as well. Because I don't want people to think out there listening that, oh, they've been doing it for 2 months, this work, and they're still in pain. Sometimes it takes a little bit longer to really regulate your nervous system.
I was thinking about this on my drive to work this morning, actually, just the word healing, because that's not quite what we're doing to me. The word healing almost feels like we're trying to get back to a former state of ourselves. The hard beauty about chronic pain is that there could actually be a gift in who you're becoming when you work through the dangers that caused you pain in the first place. So I see my own journey not as healing, but more as becoming a lighter, brighter, more wisdom filled, whatever adjective version of myself, where I would not take back that. I wouldn't take back that journey. And that's what I try to say to all patients or members at Lin is, what if there might be beauty here? And I'm not saying there is right now, but what if one day we could see it? What might it have been today that you might look back at and see was actually kind of beautiful? And right then we'll both cry, because I'm very sensitive when I work with people. And when they cry, I usually cry right back with them, because I feel their heart opening. And they say, wow, I actually, I feel connected for the first time. I feel like I could tell the truth for the first time. I'm ready to stand up to my boss, or gosh, I realized I really want a deeper connection with my kid or that person that I lost in the past. And I don't lead with there could be gifts in this journey. Let me tell you, it's part of what I learned early on, right? When I messed up 1,000 times. But one day when somebody starts kind of saying that to me, I'll say, actually, I had a lot of gifts in my journey. And I love who I've become and who I'm still becoming.
There's always gifts in everything, even the things that seem so terrible and horrible. And yes, you cannot lead with that because in the moment, you're not ready to hear that. But that is my definition of healing, what you said, right? My definition of healing is really looking back at what you experienced and how that led to who you are today. And then how can you carry that forward, right? And healing to me is not, okay, I did it, I'm done, let's move on. Healing is this journey that you are constantly on. It does not end. It is a journey. It just continues. Everything that you experience led you to be who you are today. Everything that you experience today is going to lead you to who you become tomorrow. That is that journey of life. That's the journey of healing. So it never really ends, right? And again, it's that mindset shift of people think healing, I want to be done with the pain. But what was the pain there to teach you? Who did you become because of that? Who did you become when you recovered from that, right? What lessons did it teach you? That is where the healing lies for me. That's the definition. For me, that's all my opinion, but semantics. We're all saying the same thing, aren't we?
I love that. And I agree that it's this becoming. I actually love that word. It just sounds so much nicer, so much like moving forward in our lives. So I just find that I have learned multiple lessons. I'm more compassionate with myself. I love myself more. It's a continuous journey for me. I still practice tools to regulate my nervous system daily through my somatics. It's not like, okay, I don't have pain anymore. So, it's over. I'm a new person since this pain, and I like the new person that I've become.
You can't see my face, but I have a huge humble smile and excitement. I think that the myth of the journey is that like you're pain free, you did it, you're on the other side, you're done, right? That's excusing the evolutionary role that pain actually had in your life and why it formed. I think instead it's just a cue for something different, like a cue for curiosity rather than pulling the fire alarm. So I would say is just a very pragmatic way of how this plays out. I'm in a yoga class last night and I feel a little sharp ache in my low back, right? I don't use the word pain as much anymore because it's actually, if you really get down at it and look at it, there's a throb or there's an ache or there's something else going on. And oh wow, a sensation has come up in my low back. I engage my muscles in a different way. I relax a part of my body that I didn't notice was tightened. I tune into what was I just thinking about? And I notice if I'm breathing. And all of a sudden, the sensation is totally shifted. It's information. I've learned to activate the muscles in my body in a new way that perhaps was, you know, really neurodiverse for my body and ultimately helped me increase my resiliency. And it's no big deal. Versus in the past, I would have sat there, Kegel, pulled in all my muscles, and that pain would have ruined my class. So it's like that's the change that can happen towards exploration and curiosity and opening rather than curling up into a child's pose and class being over.
Yeah, we've talked about curiosity before on this podcast. So yeah, thank you for sharing that. Are there any other words of wisdom that you would like to share with our audience?
I think the biggest thing is that if you feel like something is not meeting your needs with your care, you're allowed to leave and seek new care and provide your provider with that feedback. And if you're a provider and you feel like you can't quite meet the needs of the patient in front of you, you're allowed to refer to something else as well. That's why I do what I do. I feel like at Lin Health, we kind of pick up some of the patients that people just aren't sure what to do with at the end of the day. And there's a path forwards.
So Tara, where can people find you?
I am personally at herenowbody.com and also on Instagram at herenowbody. I actually post yoga classes that I call curiosity yoga now. So that's funny. You said you've talked about it before, but very non-dogmatic, non-alignment based, just playing. And then I am also at Lin Health, which is lin.health.
Thank you so much for being here with us today. We're very fortunate to have you and your resources that you shared with all the people listening.
I so enjoyed this conversation, and thank you both for the work that you're doing here. This podcast is so awesome.
If you'd like to leave us a message or ask a question, please check the show notes with the link so you can reach us directly, or email us at beyondthepelvis@gmail.com.